I'm Julie Zenner along with Dennis Anderson, and here's what's coming up on Almanac North.
Well, the Iron Range Resources and Rehabilitation Board decided not to put its development money into a private trust this week. We'll have more with local lawmakers.
The flu season is hitting hard in the region this winter. We'll get some tips for staying healthy from an infectious disease specialist.
And we'll have the week's business news and a video report from our friends at Almanac in the Twin Cities.
Stay right where you are. Almanac North is next. Hello and welcome to Almanac North. Thanks for watching. And Denny, it really didn't feel like January outside today. It was quite warm for a midwinter day.
I guess so. Almost a little spring-like. Give us a flavor of what's to come. We're still a long way off from spring, but
we are.
I like the tease.
It did feel nice.
It did, that's for sure.
And we've got a lot of great stuff coming up tonight, so why don't you get right to it. Okay.
All right, thank you very much, Julie. Well, the Iron Range Resources and Rehabilitation Board had a full agenda at its meeting in Eveleth this week. The agency's advisory board is made up of 9 state lawmakers, 4 Republicans and 5 Democrats. 2 of its members are here to talk about the decisions made this week. Representative Dale Lueck is a Republican board member from Aiken, and Representative Jason Metsa is a Democrat from Virginia. And gentlemen, I want to thank you both for being here tonight. Thanks for the drive to Duluth. Representative Lueck, Democrats and Republicans on the board, it seems that both parties pretty much got along in terms of deciding what to do and where to spend the money this time around.
Oh, absolutely, and it's one thing that's unique about the IRRRB is it's about our part of Minnesota, and there's less of an issue on party line things, and that's a huge thing. I mean, we're here, and we got to take care of this whole part of the state, and so it's really easy to work together in that circumstance. Really is.
Representative Metsa, the big news this week that we mentioned was that the IRRRB had scrapped plans for the private trust that was supposed to kind of safeguard these funds from being taken to solve other budget issues in the state. Why was that decision made to not go in that direction?
So we had passed it a few years ago, and we never moved the money. Because we wanted to make sure, first and foremost, in doing our due diligence with property tax dollars, essentially, distinguishing those from state general fund dollars. And in looking at the trust, the way that it was kind of headed in the interim didn't quite pass the sniff test to spend those dollars without elected officials accountable to the public, potentially, in how that formation might make up. So we looked at it as a board and essentially decided, you know, it's been spurring some conversation from colleagues who don't know what Dale and I do, and we didn't need that unneeded attention from them, and we just wanted to move on and kind of get to the next level. And so right after the meeting, Senator Thomasoni appointed himself, myself, Representative Lehman, and Representative Eklund to continue looking into other alternatives and options, but we want to do it bipartisanly. And we're
so Jason, are there instances when the state legislature can take monies from the IRRRB?
They can actually take it anytime, but if you look at the rest of the state, and it's only because we're in the state budget as a state agency, but however, we're the only state agency budget which is made up of local property tax dollars. So we've had it happen. It's mostly been political sparring between parties. And I think we're kind of all at the point where we see those dollars as needed to stay in the area, just like everyone else's property tax dollars.
So do you see a day when it will go into a trust?
It may not be a trust per se, but what's critical is we remember those are local property tax dollars, even though they come off production tax. And we're the only part of Minnesota where we're literally vulnerable to the legislature can't necessarily reach into Aitkin County or St. Louis County and grab those dollars down there. And so and that's basically what Commissioner Phillips is going to go back, and we're going to look and make sure that we've got a good way to protect those dollars so that they're not vulnerable to be taken away, because they're literally produced and intended as in lieu of property taxes, and that's the hard thing that the rest of the state doesn't always understand, that they're property tax dollars.
And are you confident that some sort of a solution can be found where those dollars are protected for the region, and yet still there isn't a controversy over not being transparent enough?
Yeah, I think that there's a path forward. What that looks like, I think we just need to make sure it's very transparent in what we do, and that we work together bipartisanly and don't give anyone reason to think there's anything going on, because there's not. Again, we're just in the state budget and looking out to keep those dollars, like Representative Lueck said. So.
Mm-hmm. Now, several grants and loans approved this week also. $5 million for bike trails in some of the old mining areas. Now, that's been pretty successful out in your neck of the woods.
Absolutely, and that's taken us really about seven years, and now we've got 25 miles of just absolute, some of the best in the nation. We've got people come from all over the North American continent, even Europe, to participate on our bike trails, and we're looking to go the next level here over the next couple of years to get up to 60 or 70 miles of trails. They're all right on the Cuyuna, between the Pennington, the Mahnomen, Armour 1 and 2, all the pit names that in our part of the Iron Range we're familiar with, where most of our dads and granddads worked, and so we're repurposing that portion of the Cuyuna Range, and it's really been successful. So, we've got 15 new businesses that have came just to Crosby just recently.
So what kind of an economic impact then do you expect from these trails?
Oh, huge. I mean, we're talking several $1 million per year just to that immediate business area, because what we started with were people that came for a day to ride, and now that we've got 25 miles, and we've also got kayaking, we've got trout fishing, we've got scuba diving, we've got some other things there. People bring the whole family for the weekend, and so now you've got people there for 2.5, 3 days, and so that's we're talking really significant, and it's relatively stable, because we groom those trails in the winter. We do winter mountain biking, and the snow. We kind of got to get the snow off the trails. So when we don't have a lot of snow, like, that really hurts the snowmobiling all through Minnesota. We continue that. That was one of the pleasant surprises, that we got people that go moonlight riding in 20 below weather and don't even blink an eye over it.
And so you're hoping that success then expands into other parts of the range with this investment.
Correct. Yeah, we put 600. Or I should say, all these numbers are up to 625 in Cohasset at the Tioga Trail. The Redhead Trail in the Chisholm area will be about 1.75 million. And then at Giants Ridge, we're going to do a gravity trail, and that was about 2.5 million. And in the interim, we're also, just like other trail systems, going to look for matching state dollars. And that's why I said up to. So we did, though, with help from Representative Lueck's area and learning from them, we know that it takes years to plan and build these, and there's only a certain amount of people around the country who do that, so we saw it prudent to get on the list early and show them we're going to be serious about this, and we're going to put up resources.
The IRRRB is supposed to be creating jobs. What kind of job creation do you expect these trails to have?
So essentially what we found, just Giants Ridge adds about $40 million in spending that goes on in the region that wouldn't otherwise be there annually. And so these are one more facet to that, and like Representative Lueck said, the trick is getting them overnight. And so you need a trail that's longer than a few miles and give them a reason to kind of come to the region and explore. And so we expect that the quality of life may attract people who want to relocate a smaller business up here, not our big mining companies or things like that, But those types of folks, a small bike shop, a coffee shop, and just other, you know, real Main Street business friendly type events for families and people to take part in.
To follow on to that, we know already one of the best recruiting tools for some of the best and brightest doctors in the country. They come to the Cuyuna Range Medical Center to practice, specifically because of the recreational opportunity, and you know, we've got Crosby Ironton, state champion mountain bike. Obviously, we got, you know, the best place to practice, but it is really a community builder, and it's brought folks from, people are coming from Mayo, bringing their families, young, talented doctors to practice at Crosby because of that quality of life that we're talking about. So it's it brings a lot of intangibles to the community besides just good hard economic investment, you know, on Main Street.
We're running a little bit short of time, a few minutes left. So run through some of the other highlights that you see from the meeting that that you think people would be real important.
So I think folks should know we had another great investment in what we see as a board in a solar plant to replace the failed silicon plant, of which the company who left silicon was current on their bills, but this is a great fit so we don't have another empty building sitting there. And another major accomplishment is access to child care. And these are things that I believe tie directly to economic development, because if you're a business, or more importantly, an employee for a business looking at coming up, if you don't have access to child care and there's waiting lists for 6-8 months, it's really hard to pick up and say we're going to forego that income and roll the dice without that. So we're putting some investments into our cities who are partnering to add on to those facilities, which will be hundreds of new spots for families to
Tell us about the solar panel business that got a substantial loan. 4.7 million, I think it was.
Yep, so it's Hellion. They're a Canadian company. Again, good bipartisan work on solar. Senator Alcorn and I flew out to DC to testify. And previous to that, Senate Majority Leader Gazelka and Senator Tomasoni had flown out. And essentially that'll create about 66 jobs.
How many people work there now?
4.
4.
Yep, so we'll go up to 66, and the day, and I should say the income levels of those will range between 31,000 and 63,000 plus benefits.
Are you hoping to get a quick return on investment?
Yes, and I think part of that comes with them ordering the equipment right away. Right after the meeting at about 8 o'clock that night, I got a call from the folks working on it. They had purchased the equipment the same day, and they plan on manufacturing this upcoming summer.
We've got about 30 seconds left. News today that could impact mining exploration?
Absolutely. It looks like the Trump administration, through the Department of Agriculture and the U.S. Forest Service, is going to significantly scale back that environmental impact statement or study that they wanted to do on that 230,000 acres of stuff outside of the boundary waters. We're talking about stuff that was never intended not to be used in forestry and mineral development, and so that's really good news. It's a little preliminary yet because obviously we're looking at you know, everybody's kind of getting on the board about how they feel about this, but it's clear that the U.S. Forest Service has been given some direction to roll that back, and let's not be doing studies on things that we're not even trying to do. We are not trying to mine up there yet. We're simply trying to explore.
And with that, we have to leave it. Thank you both for being here.
Thank you.
You're welcome.
Right,
Thank you.
Duluth has long been a popular Minnesota vacation destination, but now people are coming for its outdoor adventure scene from all over the country, and they're coming in moving vans.
When you look at Duluth, it has more outdoor and kind of open space than almost any city in America. And a lot of people have understood that and utilized that, but it's really been, I would say, in the last 5 years, maybe 6, where that's really taken off.
In 2014, Outside Magazine named Duluth the best town in America. The nation, and some Duluthians, started to see their city in a new light.
A lot of that land that kind of people saw as either wasteland or maybe just green space that's not used, the vision that really came in with Mayor Ness to utilize that open space and recreate it as a community asset.
Like tapping into Duluth's 130 parks and hiking and ski trails, and developing a 100-mile mountain bike trail called the Grand Traverse. Duluth Mayor Emily Larson says the word is out.
Every week I'm meeting someone who moved from some place because of the sense of place, because there are trails right there, because there's such a focus on being outside and slowing down. And I think one of the strengths that Duluth has is that we are not trying to be another city. We're not trying to be St. Paul or Minneapolis or Chicago. We're trying to be Duluth.
If you've managed to stay healthy so far this cold and flu season, count yourself as one of the lucky ones. By most accounts, the flu virus is hitting the region hard this winter, sending many people to urgent care and hospital facilities. So what can you do to avoid the sickbed? Joining us now with some tips is Dr. Andrew Thompson with St. Luke's Infectious Disease Associates in Duluth. And thanks for being here, Doctor.
My pleasure.
Is this a typical flu season? Because it seems to be in the headlines a lot, both nationally and regionally here.
It's a bad one. This year is the worst year so far that we've had since about 2009, 2010. So, and that's when we had a big pandemic flu. So this is a pretty bad flu season.
Are the symptoms different than they've been in the past, or is it just the severity of the symptoms that you're seeing that make it so unusual?
Flu symptoms they don't really change year to year. Sometimes severity can be a little worse, but really there are just a lot of cases this year, a lot more people being affected than usual. So they have similar symptoms to a typical flu. Fever, bad muscle aches, really sudden onset, and a cough.
Is the flu shot working, and should everyone get one?
The flu shot is working about as well as it ever works. It doesn't work that well. It's not as effective a vaccine as a lot of other vaccines that we have. And there are various reasons for that, and we really wish we had a better vaccine. But we think it's working somewhat. There has been some information floating around out there about how ineffective it is this year, that maybe it didn't work in Australia very well, and how is it doing here?
Sure.
We don't really know, and we won't know good numbers until the season is over. It's just not possible. But we know many people who got the vaccine still can get the flu. We think that's less severe when they do get sick than it otherwise would be. It prevents death and hospitalization. But it's just not that great at totally preventing the illness. People, yes, should they still get the vaccine? Yes, they should. The season could still go on for weeks to months. Sometimes it goes into the spring.
Really?
And I think we've probably hit the peak of flu activity, but it still will linger for a while. So if you haven't gotten it, it's not too late, even though you should have gotten it a month ago.
Does it help sometimes to get 2 flu shots, like with small children, I've heard?
Right. We do give that for a child's first flu vaccine. We give them 2 shots. And that's because their immune systems are immature, and they kind of need that little boosting of the second shot. Nobody else needs 2 shots. Older folks do get a higher dose flu vaccine because, again, their immune systems are on the decline, and they need a little bit more vaccine to sort of awaken that immune system.
Is there any? Go ahead.
Tell us about Tamiflu. What is Tamiflu? I know a lot of people have taken it.
Yeah.
And could Tamiflu be taken to prevent the flu?
Yeah, Tamiflu is really one of our only medicines that we can use against flu. It's an antiviral medication. It works, again, pretty well. It can reduce symptoms, and it can shorten the duration of flu if it's taken soon enough. And that's really key is shortly after people get symptoms, they need to start it to get any benefit from it. Sometimes we do use it to prevent flu, especially in like a nursing home. If there are a certain number of cases in the middle of flu season, sometimes we'll give it to the whole population of the nursing home to try and prevent further spread. We don't think that's probably effective on a population-wide basis. It would cost a lot, and I don't think we would see benefit from it. But it does occasionally work to prevent flu.
Mm-hmm. You were saying that you've seen a lot more cases this year. I imagine that the hospitals, the clinics are all pretty overtaxed with this. What are the signs that the flu is serious enough that someone should be seeking medical attention?
Right, that's a great question because a lot of people will be affected, and what should they do about it? Otherwise healthy people who are older than 5 and younger than 65 can usually weather the flu without going to see their doctor, without requiring medical attention. If they have chronic medical conditions, and there are a lot of them, chronic lung disease or diabetes or other health problems, they may need medical attention. And those who are younger and older should probably contact their doctor if they feel symptoms of the flu in the flu season to figure out what they should do. Now, severe flu and pneumonia that's associated with it is usually, symptoms of shortness of breath or, more severe illness like that. Those people need medical attention, whether that's an ER or their doctor's office.
Doctor, we're hearing stories of relatively young people in their 20s and 30s who, generally speaking, have been healthy, all of a sudden contracted the flu, and they died within short periods of time. Is the flu that strong?
It is, and if you look back to 1918 when we had a huge pandemic,
right?
Young people died at really high rates, and so this is a bad illness. It's not minor, and that's why I encourage vaccination for everybody, because children and young people can be susceptible to this, even otherwise healthy ones.
This is H3N2. That's the flu?
That's right. This year, the primary virus circulating, we call it H3N2, and that is a way of describing certain components of it. Flu mutates a lot and changes a lot, and different strains come around every year. This year, you're right, it's H3N2.
In addition to getting the flu shot, are there things that you would recommend that people do to stay away from it, prevent getting it themselves, or prevent spreading it around?
Right. As you said, get your flu shot. That's the best thing, that's the best tool we have to prevent flu. Once you've done that, if you do get ill, stay home for the benefit of everybody, your coworkers, people out in the community, the young and the old who might not be as strong. Avoid them. Please don't spread it around. So stay home if you're ill. Beyond that, practice good hygiene, cover your cough, wash your hands. Those are the tools we have.
Are local hospitals getting overloaded with patients now?
So at least at St. Luke's, we've been very busy recently. We're kind of bursting at the seams. Flu certainly contributes through people coming in with influenza and with secondary infections such as pneumonia that they get after influenza. And I know clinics have been busy as well.
Are there other viruses going around this year too?
There always are. There are respiratory viruses, things like RSV, which mostly affect kids but also adults. And there have been a lot of those cases. There are always colds and other respiratory viruses too.
All right. Well, Doctor, we're out of time, but thank you so much for taking time out of what sounds like a very busy schedule for you to come in and share some information.
A great conversation. Thank you.
Great to be here.
It's time now for the business news from the editors at Business North. Cleveland Cliffs is preparing a plan to mine land east of Nashwauk that it acquired last year from Glacier Park iron ore properties. Cliffs CEO Lorenzo Goncalves said in a conference call the company will soon submit its mining proposal to the Minnesota DNR. It's the same land Chippewa Capital Partners had hoped to mine as part of its plan to bring the former Esser Steel project out of bankruptcy. Chippewa still might be able to obtain leases on mineral-rich state land, but those parcels are scattered. Goncalves says Cliffs parcels are grouped together and accessible from public roads.
A business decision by Forum Communications is having some drawbacks. The newspaper company, which owns the Duluth News-Tribune, Cloquet Pine Journal, and Lake County Chronicle, is finding there are negatives involved with merging all three offices in Duluth. Last week, it lost Carleton County legal ads to a Moose Lake publisher. Now, a Lake County publisher is seeking to gain Lake Superior School District legal ads formerly awarded to the Chronicle. The action is related to a state law that requires newspapers to maintain an office in jurisdictions where the ads are published.
The Ashland-based Northwest Wisconsin Workforce Investment Board is working to match healthcare employers with people who are skilled in those occupations. They've created a group called Superior Talent, which will recruit those employees to the area. Recruitment activities are designed to showcase what northwestern Wisconsin communities have to offer young professionals, such as outdoor activities, locally crafted beers, and organic foods. For more on these and other stories, visit businessnorth.com.
If you have a comment on our show, call now, dial 218-788-2849 to leave a message, or send an email to almanacnorth@wdsc.org. And visit the WDSC website for our program schedule, updates on our local shows, and upcoming events here at the station. And Denny, it looks like a nice weekend ahead. Great time to get outdoors, enjoy the winter wonderland a bit.
Some of my friends are out ice fishing. They're having a ball in this nice weather.
Beautiful. You don't even need an ice house.
You're right.
For Denny and the crew here at WDSC, I'm Julie Zenner. Have a great weekend, everyone. We'll see you next time.